Okay, so this week my disease is Paget disease. So Paget disease, also known as osteitis deformans, it's a chronic progressive bone disorder that typically occurs in the fourth or fifth decade of life, and sometimes it takes another decade for the diagnosis to be made. The cause of the disease is idiopathic, but there are some associations to potentially infection with the virus as a child, and there is some evidence of genetic disposition. The disease involves abnormal bone remodeling, where excessive bone destruction occurs, and the bone is replaced instead by fibrous tissue and an abnormal bone that is thicker but more fragile. This makes individuals at risk for deformities and fractures, as well as other issues such as cardiovascular disease and heart failure. So in a healthy individual, bone remodeling is maintained through an equilibrium of new bones being reproduced by osteoblasts and the reabsorption of bones by osteoclasts. So the activity of the osteoblasts and the osteoclasts is what maintains this homeostasis in bones. In Paget's disease, that equilibrium is thrown off and therefore homeostasis is altered. Now, rather than healthy bone remodeling, Paget's disease is characterized by disorganized bone remodeling. So basically, osteoclast activity is increased, leading to rapid bone resorption. The enhanced bone resorption recruits more of those osteoblasts to the site and attempts to compensate. A large quantity of new bone matrix is produced. However, this accelerated process does not produce a bone matrix that's equivalent to that in a healthy bone. And as a result, disorganized bone tissue is formed that's thicker yet more fragile and prone to those deformities and fractures. So it typically occurs in 4 stages if you break it down. First, osteoclast accelerated activity. Next, increased activity recruits more osteoblasts to the site. Then osteoblast activity and accumulation is observed, where the bone development begins to be fragmented and irregular. As the disease advances, the osteoblastic phase becomes dominant, and excessive bone formation that is fibrous and coarse occurs, and the marrow space is filled with vascularized fibrous tissue. Now, this new bone does not have central blood vessels, so once the osteoblastic phase subsides, the new bone is poorly mineralized and therefore weak from a lack in structural integrity. Now, the disease is usually progressive, and often during a period of exacerbation, the area where it is occurring, or the bone that it's occurring in, is warm, has some erythema, and it can be felt over the area. That's due to the hypervascularity, which can lead to cardiovascular issues such as high output heart failure due to that hypervascularization. The disease most typically affects the long bones, the axial skeleton, and the skull, but it can affect nearly any bone in the body. The least common, though, is the hands and the feet. The deadliest complication of Paget's disease is the development of a Pagetic sarcoma, which is a fatal bone tumor. Some risk factors include 40 years of age and older, just because that's typically when the disease is found and occurs. And often the diagnosis is not made for another decade. Also, living in Europe, North America, or Australia, the cause of Paget's is still unknown, but it is more prevalent in these areas, and it's very rare in areas such as Asia and Africa. Another risk is infection with a paramyxovirus as a child. There has been some literature that suggests that this family of viruses are linked to the cause of Paget's disease. Now, this family of viruses is a family of single-stranded RNA viruses. They're known to cause different types of infections in vertebrates. Some members of this family of viruses include measles, mumps, parainfluenza, and RSV. Next is genetic susceptibility. So a genetic predisposition to the disorder has been determined based on population studies. It has been found to have an association between HLA markers, and also if you have a sibling with the disease, you are at a high risk for developing it. Now, often individuals are asymptomatic. Most people are asymptomatic for a long period of time and are diagnosed by incidental findings on X-ray studies. Presentation for symptomatic patients may include pain in the bones or joints. This is due to fractures, increased vascularization and inflammation. It's often worse with weight bearing due to the weak nature of the bones, and the patient's gait may also be altered due to the deformities. Next is an abnormally enlarged skull. There are bones in the skull. The disease does affect those bones in the skull, which leads to the enlargement. Musculoskeletal deformities. Replaced bones are fibrous, abnormal, and weak. The affected bones show enlargement, which can lead to deformities such as bowing of long bones. Kyphosis is another deformity that can be seen if vertebrae are involved in the skeleton. Hearing loss when the skull is involved, particularly the petrous temporal bone. Compression of the auditory nerves or ossicles may occur, which can lead to that hearing loss. Fractures, the bones are much weaker and have less structure, so even mild injuries can result in fractures. Also, compression fractures are very common. And that's more common if the vertebrae are affected. Headaches, skull involvement leads to increased pressure, which causes headaches and migraines. Cranial nerve neuropathies, numbness and tingling can occur if the skull is affected, and increased pressure or enlarged bones causes compression of the nerves. Heart failure and cardiovascular issues. When the axial skeleton is involved, often patients have increased cardiac output. Also, they can have calcified aortic stenosis, which is also common. Here is a good mnemonic for some of the signs and symptoms. Panics, pain in the bone, arthralgia, neural deafness and nerve compression, increased bone density, cardiac failure, and think skull or sclerotic vertebrae. And then this is a picture of what normal legs would look like versus in normal bones versus Pagets disease, where you can see the bowing there. Tests to assist in diagnosing Pagets disease include bone scans, bone x-rays, elevated markers of bone breakdown, such as N-telopeptide. People may also present with elevated ALP or alkaline phosphates. Urine tests can be done to detect elevated C-telopeptide and N-telopeptide, which are those markers. Hyperuricemia is also common due to the high turnover rate of bones. And some patients develop hyperparathyroidism due to inadequate calcium from increased demand. Now, bone x-rays may reveal cortical and trabecular thickening. It may also show osteosclerosis that looks like arthritis, bone expansion, or osteolytic areas. Bone scans can be useful in detecting the disease before symptoms occur or detecting early changes in the bone, and can also help document the extent and progression of the disease.